Welcome to Integrity Linguistics Institute, the developers of the OET Exam Mastery app. My name is Dr. Shrikanth and I'm the head coach at Integrity Linguistics Institute, and today I'll be teaching you a little bit about the OET speaking test in a very interesting as well as in a very entertaining way to help you ace your speaking subtest. So are you ready? All right. So good. Let's begin right away with today's session. So let me just introduce to you the core concepts of the OET speaking test, and progressively we'll be explaining to you the essential skills that you need to excel your OET speaking test. Okay? Well, let me just introduce to you what the OET speaking test is in a general manner. So the OET speaking test lasts for exactly more or less 20 minutes. All right. And during these 20 minutes, you will be assessed based on how well you can communicate with patients in a medical scenario. But please remember, you are not going to be speaking with real patients. This is going to be a mock patient counseling test or a mock bystander counseling test with the staff of OET, whom we call the interlocutor. So understand that the OET speaking test is a 20-minute conversation between you, that is the OET candidate, and you will be a medical professional, a doctor, a nurse, a pharmacist, physiotherapist, etc. And you will be speaking to an interlocutor who will be pretending to be a patient. All right. Now, during the 20 minutes speaking test, you will be required to complete not one, but two separate role play scenarios. All right. And each role play scenario will last for 5 minutes. So understand that you will be counseling a patient not once, but twice. All right. And each of the counseling tests will last for 5 minutes. So like this, two separate tests, and both the scenarios will be specific to your profession. So if you are a doctor, obviously you will be getting an OET speaking question paper or a cue card which is related to the MBBS profession. And if you're a nurse, you will be getting a nursing cue card so that the candidate can effectively communicate with the person. Understood? All right. So on your examination day, this is how your question paper will look like. So it is not exactly a question paper. As you can see, you will be handed a card. So we call this the OET speaking cue card. And in this card, they will explain to you the medical scenario. That is, whether you are counseling the patient in an emergency department, whether you're seeing the patient in an emergency ward, or you're visiting the patient at their home. All right, and they'll give you the age of the patient, the diagnosis of the patient, all right, what the patient wants from you, the purpose of this counseling session, as well as the different things, the tasks that you're required to complete during this speaking session. Okay, so like this, you'll be given two cue cards on your examination day, and in total, the exam will last for 20 minutes. Okay, so now let me give you some really good tips to help you ace, to excel in your OET speaking test. All right, so remember that we at Integrity Linguistics teach in a manner which is very interesting as well as very captivating, so that you really develop your interest in your OET preparation. So when it comes to speaking, all right, just remember the word speak. And speak over here is basically an acronym, all right, and we can abbreviate into certain strategies. So S, the first alphabet in the word speak, stands for structure your responses. So remember, these are all strategies, and over here I'm giving you 5 unique strategies that will really help you to understand and grasp the requirements to get really high scores. So what is the first strategy? Well, repeat after me. It is structure your responses. So what does that mean? I will explain it to you. Now let's come to P. So what do you see over here? P stands for professionalism and empathy. E stands for engage actively. A, adapt your language. And K, Keep it natural and fluent. All right. So if you can just make a small note of this, I will explain it to all of these things so that you can really prepare for your OET speaking test in a really good manner. So let's move on to the first strategy over here, which is structuring your responses. So can you please tell me what is the meaning of response? Responding. All right. So that is basically replying back. Now, when it comes to the OET speaking test, you are not the only person who is speaking. Along with you, we have another person, the interlocutor, and the interlocutor and yourself, the OET candidate, you guys are having a conversation amongst yourself. So you will be talking to the interlocutor who is the patient will be speaking with you, and you will be required to give appropriate responses. All right. So when it comes to responding to the statements of the interlocutor, it is very important to have a very structured, systematic, and organized thought process. So you must be able to convey your message very clearly. So this is what we call as structuring your responses. Now in your cue card, there are certain tasks. All right, so we saw the cue card, how it looks like. So there may be 4 tasks or 5 tasks, and your duty over here is to elaborate on each of those tasks as clearly as possible. Now, for example, let's say that you are dealing with a patient, all right, and the patient needs to start with an antibiotic regime. Okay, so he needs to take an antibiotic for the next 5 days. Now, you have to understand that you are a medical professional, but the patient is not a medical professional. So they will not understand the importance of medication compliance or medication adherence. All right. So in the task, they will write, explain to the patient regarding the benefits of the antibiotic therapy. Now, in that case, instead of directly going to the benefits, organize your response in a clear manner. So go by step. So first and foremost, you can, before directly talking about the advantages of an antibiotic therapy, you can just tell the patient why this treatment is necessary for the patient, right? So, and make the patient understand. Let's give the patient a name, Mr. John. Please try to understand that you're suffering from a bacterial infection, and we really need to treat this with an appropriate antibiotic regime so that we can cure you of your illness. And following this prescription that has been prescribed to you by a doctor has several benefits. So the first benefit is that you will be able to recover very quickly. Second is we can keep your infection under control. And the third is that we can prevent further medical complications. Are you able to understand my points, Mr. John? Now you see, this is how you organize your thought process. So when you have a task, understand what the message is, and instead of directly, going into the tasks, take your time, structure your responses, have organized thought clarity, and then speak. So this is what we call structuring your responses. Again, a lot of practice is required, and through practice only, you will be really improving. Now, let's come to P. What does P stand for? So obviously P stands for professionalism and empathy. So remember, you are a medical professional, a doctor, a nurse, a pharmacist, etc. And you're handling a patient in a professional setup. All right. So it is very important to have that professional appeal with you throughout your speaking test. All right. So a professional will always be very bold, will be confident, will be assertive, will really be able to understand that they are speaking to a patient who is not really well. The patient requires a lot of emotional support as well as a lot of medical information from you. And we really need to make sure that we are empathizing with the patient, sympathizing with the patient, reassuring the patient, and navigating the speaking in a structured manner. All right, so the tone in which you speak, the rhythm in which you speak, the statements that you use should all be very professional. All right, so we will be training you exactly how to do all this. So, a small reminder is that when you are counseling a patient, use very friendly as well as supportive language. I mean, the patient should feel very comfortable in your presence. So, you will be coming across lots of different types of patients like angry patients, frustrated patients, depressed patients, patients who are very nervous, who are very concerned, all right, patients who just are completely unaware of their diagnosis and who are really looking for proper treatments from you. All right, so understand what type of patient you're dealing with, and throughout your speaking test, be very friendly and be very supportive. All right, so this shows professionalism in the way you speak. Always acknowledge the patient's emotions. So, for instance, if the patient is opening up to you and telling you that he is quite concerned, or he is very anxious, or the patient is quite confused, all right, acknowledge it. There is no need to be in a rush to go to the next task, okay, or there is no need to be judgmental to the patient. Understand him, empathize with the patient. Like, that is, empathizing basically means understanding another person's situation from their point of view. That is what we call as empathy. Sympathy is where you're just feeling sorry for a person. All right, so I understand. So understanding, emotionally connecting with another person is what we call empathy. Sympathy is different. Sympathy is where you're expressing sorry. You really feel bad for the person. All right. So empathize. I understand, Mr. John, that this can be very concerning. I completely realize what you're going through. I connect with you on a personal basis. As a parent myself, I really understand what you must be feeling about your child. Okay, so you remember? So we get both bystander cue cards, patient cue cards, etc. So professionalism and empathy, and this should be reflected in the words you use as well as in the style of speaking, because you need to understand how your speaking is scored. So your speaking is actually recorded. The interlocutor does not have any role in giving you the scores. Your conversation is recorded, and this recording is sent to the headquarters of OET, which is located in Australia, and there highly trained evaluators listen to your audio. They see how much structured your responses are, how professional you are, how much empathy you have, how you're handling the patient, the English you're using, and then they score you. So it is very important to have a very pleasant and an impressing speaking audio recorded. All right, now let's come to the third skill that you need to develop so that you can effectively prepare for a OET speaking test. So we completed S, we completed P, and now we are going to E. Engage with the patient. So when you're dealing with the patient, okay, it should be two-sided. It should not be one-sided. Like, you should not predominantly be the main character over there and completely, ignore the patient. So this is a conversation, and especially when the patient is speaking to you, you must actively listen to what he or she is saying, because a good counselor is automatically a good listener. Understand what the patient's reply are. All right, because if you're going to stick completely to the cue card, then you may not give appropriate responses. To give appropriate responses, you really have to actively listen to the patient. And it is very important to ask follow-up questions. So for example, you will be giving a lot of medical information. All right, so you'll be giving a lot of important medical information, such as the importance of medication compliance, how to, do proper wound care, follow-up visits, how to provide care for their children or wife, etc. So, like you'll be giving a lot of life-saving, again, I'm repeating, life-saving important information. And it is very important to confirm that the patient has understood your words. they have understood the message. All right, so if you give a really great medical life-saving information, and if you just simply move on to the next task, then that shows that you're not really engaged with the patient. All right, so, and there is no need to be in a hurry. There is no extra marks given for completing all the tasks in your cue card. Always remember this. Okay, so no need to be in a hurry. Take your time. So for example, if the patient is unsure, like you have explained the medical information, like for example, you have talked about the importance of medication compliance, taking the doses of the medication at the right time, at the correct time, as well as the correct dose, and not skipping the doses, not missing the doses of the medication. All right, you have given them advice regarding prevention of certain medical complications, etc. Ask them, Mr. John, is there any doubts regarding the statements I gave to you? Or you can ask questions like, am I clear to you, Mr. John? Are you able to follow me, Mr. John? Okay, so like this, you can ask a confirmatory question to confirm that you have completely clarified your explanation to the particular person that you're counseling with. All right, so engage with the patient. All right, listen actively, okay, and give appropriate responses. And when you are giving an appropriate response, especially if it is a very crucial information, you have to understand that asking follow-up questions is very much significant as well. Okay, so this is how you engage with the patient, and make sure that it is not a one-sided conversation, but it is an interactive, two-sided conversation. Next is adapt your language. So what does adapt mean? Adapt basically means adjusting. All right, so remember, on your OET speaking test, it is going to be a complete surprise. You will have no idea what type of cue card you're going to get. Whether you're going to get a patient's cue card, whether you're going to get a bystander's cue card, whether you are going to get a patient with whom you're already familiar with, or whether it is a patient or a bystander you're seeing for the very first time, whether it is going to be a home visit. So there are different types of cue card, and there will be different types of patients. As I previously mentioned, you can expect happy patients, healthy patients, confused patients, angry patients, frustrated patients, sad patients, etc. All right, so nervous patients, again, the options are quite limitless. So you really have to understand the emotional wavelength of the patient, understand in which situation the patient is in, and accordingly adjust your speaking. The OET is not simply about the words you use. All right, so don't please have the misconception that OET simply assesses your English language proficiency. It uses your English language as the base. All right, that is the foundation, but the OET is testing you on how professionally capable you are at handling a patient in a real life medical scenario. All right, so I'm giving you one small example over here. So for example, you have to explain a diagnosis. So let's just say that the patient is suffering from pharyngitis. All right, so you are a medical professional, so you know what pharyngitis is. That is, it is an infection of the throat. But the patient will have absolutely no idea what pharyngitis is. And you can take a lecture on pharyngitis for the 2 minutes and the patient will understand nothing. So it is best to simplify your terms in layman's language. Again, understand the emotional wavelength, understand the situation you're in. All right, again, if it is a frustrated patient, if it is an angry patient, if it is a happy patient, if it's a nervous patient, the tone in which you speak, the words you use, the reassuring statements, the empathizing statements, the sympathizing statements, everything will be completely modified. So that spontaneous knowledge you must have. And we at Integrity Linguistics, we completely give you that training by giving you individual sessions. All right. So in this particular case, if you're going to talk about complex medical terminologies, it is not going to show you that show the evaluators that you are very much engaged with the patient. So you can use slightly layman terms. So for instead of using pharyngitis, you can say sore throat. Mr. John, basically you're suffering from sore throat and these are the symptoms. All right. And in order to overcome this, you need to take your medications as prescribed by the doctor and you need to come back for a follow-up visit. You understand? So you have to use like sometimes very basic language, but with a lot of genuinity and authenticity in the way you actually convey your message. Now, for example, if the patient has been diagnosed with myocardial infarction, the patient is not going to understand if you use the same words, right? So you can say heart attack, hypertension, you can say elevated blood pressure, all right? So this is how you can actually take your speaking forward. Now it is K, okay? So S-P-E-A and the last one is K. Keep it natural and fluent. So be very relaxed. I have noticed several students, especially in individual speaking sessions, they tend to be very nervous. Now let me ask you a question. Imagine that you are a patient. You are a patient and you have gone to a hospital and you are seeking treatment from a doctor or a nurse. A doctor is now evaluating you or a nurse is evaluating you. But the doctor is very nervous. The doctor is very concerned, all right? Or he is very anxious. Would you feel comfortable getting treatment or getting counseled by this doctor? Would you be completely confident that this person is really going to help you recover? Of course not. So if you are sick, you want to be in the presence of a professional who is confident, who is assertive, and who knows what they're doing. All right. So similarly, when you are a medical professional and you are counseling another person, it is very important you yourself be confident, bold, and take the counseling session with a little bit of authority, compassion, kindness, respect, and professionalism. And all this comes when you're in a very relaxed state of mind. And avoid memorizing anything, because the OET evaluators, they are highly trained to recognize if anyone has memorized anything. So if you memorize certain sentence templates, whether it can be the beginning of the cue card, it can be the explanation of certain things, or it can be the ending of a cue card. If they feel like you are speaking from a memorized template, they will not be giving you high scores. All right. So prepare effectively, go through certain ways of counseling a person, but ultimately when it comes to the actual speaking test, understand that you have to completely have faith in your preparation. Be relaxed, understand what is given in the cue card, all right, and speak with professionalism, having thought clarity, engaging with the patient, all right, and adapting your responses according to the emotional wavelength of the patient, and always keep it natural. Be yourself, all right, be yourself. Mistakes will happen, no problem. All right, so again, as I told you, let's say that you're a patient and you're having a consultation with a doctor. So while speaking, if the doctor makes a grammatical mistake and if the doctor is quite nervous, you as a patient, will you feel confident? Of course, no, right? So even if you do make certain grammatical mistakes or sentence errors, forgive yourself, bring it back, bring your confidence back and take it forward. All right. Now, a small tip that I can give you is like, imagine that you're speaking to a family member, a very close friend, all right, the interlocutor, and you take your session forward. All right. So we have actually completed the small tips. So I hope this session was quite beneficial for you. Now it is time to practice, because practice makes perfect. All right. And we at Integrity Linguistics, we give individual speaking sessions at convenient student times, and we actually give almost 1 hour workshop on a daily basis. We provide individual sessions on a daily basis, and we, no matter what level you're in, we will help you to achieve your desired OET scores. All right. So I'll just give you one small topic over here, explaining a new medication. So let's say that the patient needs to start taking and hypoglycemic drugs. So let's say the patient is basically a diabetic patient and he needs to start taking hypoglycemic drugs, anti-diabetic drugs, to regulate his or her high uncontrolled blood sugar levels. All right, so how would you start the conversation? So imagine that you are speaking with the imaginary person, all right, and you're explaining about this particular medication to this particular patient. Now, using the speak method, how would you actually take this conversation forward? So I would like to see your comments below. So if you're told you are willing to show your OET skills, you can comment down in the below and I'll definitely get back to you. All right. So remember, SPEAK. All right. So S stands for having very structured clarity. P stands for professionalism. E stands for engaging with the patient. A stands for adapting to the emotional wavelength of the patient. And K stands for keeping it simple. All right. So I hope this conversation was very helpful to you. So thank you so much. My name is Dr. Shrikanth, the head coach of Integrated Linguistics, the developers of the OET Exam Mastery app. All right. On a daily basis, we'll be uploading several other content. All right. So next class, we will be giving you details regarding the common role play scenarios in OET speaking. All right. So I would highly recommend you to subscribe for daily OET tips and see you soon. So wish you all the best. Thank you so much for your time.